Hi everyone. So my presentation is on occupational therapy in the NICU. A little bit of background, as we already know, occupational therapy in the NICU is highly specialized. It requires a lot of understanding of medical conditions and experience in pediatrics. Understanding appropriate development is crucial. It also requires a lot of continuing education and supervision when you first start out. Some areas of occupations that we address are early caregiving and interaction with the infant, pre-feeding, breastfeeding, or bottle feeding, touch, bathing, skin-to-skin contact, diapering, dressing, undressing, and much more. So factors influencing infant participation include prenatal or perinatal conditions and complications, which are pretty common, gestational age at birth, weight and comorbidities, physical and developmental maturation, context, environment, and much more. So the impact of prematurity on development is, as we probably already know, preterm birth is associated with higher infant mortality rates, developmental delays, physical, social, and mental health issues. In addition, preterm infants usually have reduced attention and responsivity, so that impairs the caregiver's ability to respond appropriately to their needs. And sensory processing difficulties are also closely linked to premature births. In a study that I found, about 46% of the participants in the cohort study exhibited some form of sensory processing difficulty when they grew up. In another study about head lag, um, so head lag, first of all, is when you're pulling a baby from supine to sit holding onto their arms, and instead of their head flexing forward, their head stays extended backwards, and so they're not in alignment. So a head lag is a huge sign of decreased postural control. As we know, postural control is the basis for a lot of motor movements. Persistence in head lag was found to be associated with cerebral injury, sepsis, longer stays in the NICU, inotrop use, and longer endotracheal intubation. However, persistence in head lag was not associated with altered neural behavior when assessed at age 2. So when you are in the NICU, if you get the chance, head lag is one of those red flags that you want to look out for, and will give you an idea of how the baby is developing neurologically and motorically. Caregiving approaches in the NICU. Premature infants who receive individualized developmental care in response to behavior showed significant motor function improvements when compared to infants who were cared for in the same NICU without this approach. So this study was done back in the 90s. Prior, they had believed that preemie babies needed a lot of sensory stimulation, and we know nowadays that this is not the case. Um, Instead, they designed a more individualized sort of approach um, that worked in response to the baby, um, and this showed much greater improvements. So what does this mean for us? We have to be flexible and adjust our care in response to the infant's behavior. We work on their schedule. We do what we need to do when it's convenient for them. Parent stress, as Alexis had mentioned before, parent education is a huge part of working in the NICU, because the parents are going to be the one completing some of these occupations with the baby when the baby is discharged. And you can imagine learning all of this new information while stressed is very, very difficult. So we have to take a family-centered approach and make sure that we can do everything that we can to not only educate the parents, but to ensure that they are as less stressed as possible. So, a study done by Dr. Schreiber actually found that the most stressful aspects of having a child in the NICU is the disruption of the parent baby role and how the child looks or behaves. We can't do too much about how the child looks or behaves, but we can definitely educate the parents on why the child looks and behaves the way that they do. Now, the parent baby role, we have a huge part in, and just encouraging that parent participation as much as we can will decrease the amount of stress that these parents are feeling. And this would not be a presentation by me if I did not include mental health outlooks. So we are holistic as OTs, and like I had mentioned earlier, preemie babies are very susceptible to developmental delays and disabilities. So children with these developmental disabilities are more likely to be diagnosed with severe behavioral disorders or mental health diagnoses when compared to typically developing peers. So, some interventions that I found to be successful for dealing with children from age 0 to 5 are massages, skin to skin contact, parent child interaction therapy, which is really only good for behavioral concerns, and then parent training. So, the idea of the massages and the skin to skin contact is providing that sensory input that helps with self regulation and calming. It was really hard to find a lot of studies that had really good rigor. And as you can imagine, this is probably because of the ethics of working and studying such a vulnerable population. Um, as you can see, this baby here is about the size of the person's hand. So you can't you can't risk. There can't be a lot of risks when doing research, and so there's the comfort aspect of the researchers and the comfort of not only like the babies that you're taking care of, but their parents too, and even the staff that's around you, which is really important to consider. And that's it. Thank you.